Afterward. The Montana sedation law, passed in February 1918, was not repealed until 1973, when the state's criminal codes were revised. However, after the armistice of November 1918, the Montana Council of Defense and the Montana Loyalty League continued to focus attention on radical labor groups such as the Industrial Workers of the World, while anti-German activities declined. Still, 79 people were convicted of sedition and 47 were imprisoned, with sentences up to 20 years as a result of the civil liberty-crushing xenophobia. Not until 2006 were 78 of those convicted pardoned posthumously by Governor Brian Schweitzer, who is the grandson of German-Russian immigrants. Cases of Spanish influenza continued to occur in Montana through the summer of 1919. Although the number of cases decreased dramatically after the epidemic peak in October and November 1918, the cause of influenza in humans is a virus was not identified until 1933. An effective vaccine to protect against influenza was not developed until 1938 and not licensed by the FDA until 1945. A hospital was opened in Forsyth in 1921 after campaigns using the slogan, "Remember the 1918 flu epidemic," garnered the support needed to pass this necessary bonding authority in 1919 and 1920. The syndrome encephalitis lethargica affected thousands of people around the world from 1915 until the mid-1920s. Some of those with this syndrome recovered within a few weeks or a few months. Others developed a severe condition in which their bodies were frozen with rigidity. This severe catatonic syndrome required institutional care for many. In late 1960, some survivors were revived by the use of the drug L-Dopa. Neurologist Oliver Sacks, in his book Awakenings, 1973, described the near miraculous response of this drug to some of these patients. The cause of the syndrome remains unknown. If Dr. Harvey had recovered from encephalitis lethargica and enrolled in a public health training program such as the one launched at Yale University in 1915, he would have had the opportunity to participate in delivering extraordinary public health achievements in the 20th century. These achievements include decreased maternal, fetal, and infant mortality, and increased life expectancy in the United States. Recognition and treatment of diseases such as diabetes, mellitus, tuberculosis, and many others improved dramatically. Preventative steps, particularly the use of vaccines, saved millions of lives. The behaviors stimulated by fear, anxiety, and beliefs related to war and disease described in this story were not unique to the early 20th century.